Hello, and welcome to our podcast, in which we will talk about a disease that not a lot of people know of. Hutchinson-Gilford progeria syndrome, or simply known as progeria. It is a rare, fatal genetic disease displaying an appearance of rapid aging in children.
So, what causes really progeria? To know this, we have to go into the cell and a certain process that is carried out. In normal cells, there is a gene called GMLMNA, which encodes the protein prolamine A. Attached to this protein are hydrophobic molecules, which are removed from it. Now, what would happen in a normal cell is that the original protein would transform into a new one called lamine A when the hydrophobic group is pulled apart from the protein and does not stay in the barrier of the cell nucleus. This process changes in organisms affected by progeria. Their cells cannot get rid of the hydrophobic group, so the protein sticks to the nucleus and causes an unusual and abnormal state of the cell.
Children with progeria usually develop the first symptoms during the first few months of life. The earliest symptoms may include growth defect and a locally affected skin condition. Additional conditions become apparent usually around 18 to 24 months. Limited growth, full body hair loss, and a distinctive appearance are all characteristic of progeria. Later, the condition causes wrinkled skin, kidney failure, loss of eyesight, and a cardiovascular problem. People diagnosed with this disorder usually have small, fragile bodies, like those of elderly people. The face is usually wrinkled, with a larger head in relation to the body, a narrow face, and a big nose. Prominent slap veins are noticeable, as well as prominent eyes.
But a recent study has given promising results which show a bit of hope for children with this disease. While investigating a drug called FTI, which was originally intended to treat cancer, it was discovered that it could reverse, within 2.5 years, the general cause of death in progeria, cardiovascular disease. So, hypothetically, this drug could elongate patients' life, which tragically does not surpass 13 years of age in most cases. Thanks for listening to this podcast made by Nicolás, Alejandro, and Dylan. For more information, check out www.progeriaresearch.org.